Hello, Washington chiropractors. Over the past few weeks, the WSCA has received a number of calls from members wondering how they're supposed to respond to questions about their rates. PIP carriers, as well as some other entities, have been calling chiropractic clinics inquiring about the costs for specific services, and chiropractors and their staffs are unsure how to respond. They're wondering if they are to give a quote, whether that quote should be what health plans pay, what cash payers pay, or if they should give some other figure. There is some added confusion here because all of these calls are coming just as the No Surprises Act has taken effect. The first thing to consider is who the caller is. If it is not a current patient or prospective patient, you do not have to give them any numbers at all. If it is a current patient or prospective patient, then the quote would need to be given in accordance with the No Surprises Act, which requires it to be made in writing. Even then, the quote is limited to what services the patient can reasonably expect to receive, and not simply any service for which they ask a price. If it is not a patient and you feel the need to give a quote, you should preface any dollar figure with a statement indicating that actual fees depend upon the unique clinical findings revealed through an examination. With that stated, the amount that you would quote for any given service is the actual cost of providing that service, regardless of how it is paid or who the payer is. That is, the rate is the cost of delivering the care as well as getting paid for it. Remember that your cash rates are not the discounts on the service. The lower amount you collect from cash payers reflects the lack of administrative costs related to billing and collecting for the service. The cost of the service itself is what it is. It never changes from patient to patient or from payer to payer. The administrative costs are part of the total cost for the service and may or may not be collected depending on whether they are actually incurred. Likewise, the negotiated rate you receive from a third-party payer is not the rate for the service. The negotiated rate is simply a partial payment of the actual rate that you have agreed to accept from that payer. So when asked by a patient, you give them a written statement of the reasonably expected services. Prior to an examination, this is basically limited to an exam fee and possibly an adjustment. When asked by anyone else, you are not required to quote your rates, but if you do, the rate is whatever you would be billed to a self-payer who is not paying at the time of service. Clarification on this question and others like it can regularly be found in the DC FAQ section of each issue of Plexus, and they're one more way that the WSCA is helping chiropractors help patients.